Okay, continue.
All right. I was saying the other one under clause the injuries is the major renal trauma. This may occur as a result of rapid acceleration, for example, in aircrafts and the accidents. So this brings about tears to the kidneys as well as the thrombosis of the veins. So when the vessels gets thrombosized, uh, the functional unit of the kidney, which happens to the which happens to be the nephron, the cells of the kidney, which happens to be the cells, the nephron gets damaged. They get damaged because the blood vessels that brings all sorts of nutrients, they get damaged. Next, the late effects of renal trauma include the prerenal correction of urine. There'll be problems with the urine formation before it starts to collect in the calyces and the major calyces before the ureters comes in to connect so that the draining of urine can start collecting for in readiness for transportation to the urinary bladder. Then urinoma or scarring of the kidney. So any trauma that comes or gets exposed to the kidneys gets starts drop some scars because with time the kidney starts to undergo the process of healing as a result of the trauma which it was subjected to. Then the renal artery stenosis leading to hypertension through healing by fibrosis. The healing process leaves some scars. As a result, the blood vessels they no longer function like the way it used to be. As a result, there is a reduction of blood flow to the renal system, which brings about uh, hypertension because the kidneys are no longer able to filter out the fluids in the manner they used to do before the injury. There's also hydronephrosis may be an early or late complication. Hydronephrosis may be an early or late complication. So in most cases, you find that there will be a retention of urine, the retention of urine, which it could come as an early or a late time, depending on the damage that may be there, depending on the damage which may be there. So it is very important that when a patient presents with the and next, hello,
Yes, continue. Continue. There is a
I
break.
can't see the slide.
There is a break in the internet. You continue now.
I can't see the slides.
Oh, wait. Wait. the same slide? Is it the same?
Check the previous slide. Let me see the previous slide. Okay, so let's go to the next slide.
This one?
Next slide. Okay, so the signs and symptoms of history of injury, Lopen and hematuria are present in the severe injury which causes a mass swelling in the lung which increases in size. That's why we say there's need for you to know the size, the normal sizes of the kidney so that you are able to detect the abnormality. You are able to probe further as to why the kidney is looking bigger. Signs of shock, tachycardia, that would be low BP, pallor, sweating, etc., which may be a sign of injury to other organs. So when other organs get injured, there will be signs of pallor, low BP, as well as sweating, which just determines that someone is in pain. Next. So investigation that can be done when someone comes with injury to the renal system. You can do urgent exploratory urogram to determine the extent of renal damage. So you need to do this investigation using a special machine just to know how good are the kidneys able to carry out their expiratory law of function. So you need to do that so to find out the kidney still having the strength of excreting out the nitrogenous waste from the body. An angiograph to assess parenchyma and vesicular damage. Under angiogram, we just want to assess how good how good are the cells of the kidneys. We're talking of the nephron. We want to find out if the nephrons are still in good health. Then the renal scan using tectonium, renal scan using tectonium 99M, it can be used. This is a special machine that is only used to scan the kidney with the ability to detect if the juxtaglomerular apparatus or the cells of the kidneys, which happens to be the nephrons, are working very well. Next. So in most cases to do with trauma to the kidneys or trauma to the renal system, treatment will include bed rest. In most cases, to help the patient to heal. Then in severe cases, exploration and partial nephrectomy. In severe cases, you need to open and see how severe is the trauma. Where you find that the trauma or the injury is quite severe, they may need to remove part of the affected kidney, what we call partial nephrectomy. All urine reported escaped and the time of occasion marked on the label so that the amount of blood in each specimen is kind of that of the previous one. So in other words, we're talking of urinalysis. We need to have a look at the parameters of urine. Once the patient has voided urine, you need to look at the hematuria, and the next time the patient has to board again, you need to look at the parameters of the hematuria and compare at the 2 times that the patient has passed urine. In trying to do so, we want to see if the patient is improving or the patient is getting worse. Next. So the prognosis, how is the outcome? The outcome varies depending on the cause and the extent of injury. The damage may be mild and irreversible, it may be immediate life-threatening, or it may be prolonged and result in complication. So the prognosis of the outcome, it may depend on the cause. Is it gunshot, is it aircraft, or is it just a blunt injury? So this may depend on the cause and the extent of damage that it has caused to the kidneys. And it may be life-threatening because we know how significant the kidneys are in as far as the physiology of the body is concerned. Next. Then the possible complications when someone has been exposed to renal trauma, pain is there due to damage of the renal system or due to damage of the kidneys. Then we also have renal hypertension, even if there are no signs of renal failure. Renal hypertension will always be there because of the reduced blood flow to the kidneys, which could be as a result of renal stenosis. Renal stenosis, which we mentioned earlier on, as a result of healing by fibrosis. Then infection of the urinary tract. Infection of the urinary tract comes in because the urinary undergoes inflammation as a way of trying to bring about healing to the trauma that has affected the renal tract. Then infection of other areas, like where we mentioned of peritonitis, if the peritoneum layer has been damaged, which is adjacent to the kidneys. Then bleeding may be there, but at times this bleeding can be very minimal. This bleeding may be there, but may be very minimal. And this will also depend according to the extent of injury that has been caused to the renal system. Next. Then this bleeding may also be severe. The hemorrhage may be severe or minor. Like I've said, this would depend on the damage that has been caused, the extent of damage that has been caused to the kidneys or the renal system will bring about the bleeding being severe or minor. Then shock due to involvement or damage to other organs. Then acute renal failure, one or both kidneys. So the renal failure at times can be both kidneys. All of the kidneys have been affected. If one kidney is affected, then the patient may have acute renal failure of one kidney. But if both of them are involved, then the patient may have both acute renal failure of the kidneys. Then it can be also chronic renal failure of one of the both kidneys, depending on the extent of damage that has been caused. Then we also mentioned earlier on renal artery stenosis. Renal artery stenosis as a result of healing by fibrosis. So all these are complications which can be associated with trauma to the renal system. Next. So how can we prevent trauma to the renal system? So external damage may be prevented by using general safety measures, for example, using safety equipment during work and play, wearing seat belts, and driving safely. So they say prevention is better than cure. So if you want to prevent trauma to the kidneys, we need to pray with we need to avoid praying with the sharp instruments that they can damage uh, our abdomen, like the stabbed wound, which can have access to the kidneys. We need to avoid those. Then wearing seat belt so that when we can be exposed to no traffic accidents, we intend to avoid ourselves hitting into the dashboard of the car or screenboard of the car, so that we prevent some injuries. Then we are also talking of driving safely. You don't have to be speeding, cruising so much, which can bring about those traffic accidents and bring about various road traffic accidents, which can predispose ourselves to injury of the kidneys. Then toxic injury may be prevented by properly observing the directions for use of medications or other products. Kidneys can be damaged with chemicals, and chemicals can be consumed in various ways, e.g., through medications. Medications are chemicals, so if you take them wrongly, not the way the medical personnel advise you to be taking them, then you may predispose yourself to damaging the kidneys. Next. So follow the directions of the medical care providers for use of all medication, including over-the-counter medications. So when you've been given medications, there are directions or instructions that the medical personnel gives you as to how you're supposed to take those medications, so that you avoid some certain side effects which can come along with those medications. And they even tell you some drugs or medications which are supposed to avoid to prevent drug infection, which can bring about um, damage to the kidney, because the kidneys functions as excretory organs in removing the nitrogenous waste, which includes poisonous substances which comes from the medications. Then use cleaning products, solvents, and fuels as directed in well-ventilated areas, because the fumes may be toxic. So these fumes which may be toxic can come from various products that we like using, and therefore we need to use them as directed by the manufacturer, so that we are to avoid various uh, poisonous which can be held through breathing, and through breathing this nitrogenous waste can reach the kidneys through systemic circulation and harm our kidneys. Then be aware of potential sources of leading poisons such as oddments, vapor from lead-coated metals, alcohol, distilled, recycled car radiators, and similar sources. So we need to take note of these various poisonous substances, including the metals, which have the ability to damage our kidneys. In so doing, we'll be able to prevent injuries or trauma that can be associated with various use of chemicals as well as metals. Next. So that is the end of our class questions. Drop them in the Google class, then I'll be able to respond.
If they want to speak, they can speak. Still, we have 15 minutes time. Okay, now you can unmute your videos. You can unmute your audios. Mr. Piri, are you there? Mr. Piri? Mr. Piri? High class, Mr. Piri is not around.
Okay, sir.
Okay. Maybe you can post your questions in your Google Classroom. He will answer.
All right, so we'll post them then.